prepared to die.
But
people
what about
died in the
10 people who died in the
fire?
Fire. They were locked down. They couldn't get out.
That's a different situation. You are based on.
It's not a different situation. They were
It
locked
is.
down.
It is a different situation. It's based on this information. As a media, you have to carry the right message instead of making your judgment based on those fabricated
How is it different? Can you explain?
They weren't trapped?
No, but of course, in the fire situation, like the gun violence in this country, you have the different variety of situations. And you cannot simply attribute the fire, the casualty, to what you have fabricated in your mind before you draw the right conclusion.
All right, interesting conversation there. Let's bring in Oksana Pijic from London. She's a senior lecturer and global health advisor at the University College of London School of Pharmacy. Oksana, we're going to look at all this from a health standpoint, okay? China's policy for 3 years now has been to achieve zero COVID cases. Is that still achievable?
Well, we see that COVID is now, we're in multiple reinfection states in every country in the world. So it is in its endemic stage. So the longer that China, which does have a very low COVID rate of infections compared to every other country, as a result of that, it actually has a big vulnerability because they haven't built up as many tools against it.
Okay, hold on. Expand on that. What do you mean tools? Are you talking about vaccinations or are you talking about immunity within the population?
Well, the immunity gap results from both. So you can have, and in both cases, we know that whatever you receive from the natural infection, or if you get vaccinated, that protection wanes over time anyhow. So that is this is why we have boosters available, and now this new bivalent booster that both Pfizer and Moderna have come up with that is more effective against Omicron. So you are able to then resist these surges in hospitalizations with effective booster campaigns. That's not happening with the most vulnerable populations in China, as well as the fact that if more people have been affected over time, it's less likely that everyone's going to get sick at the same time. So there are different things, as well as treatments available. So China has relied on homegrown vaccines only.
What happens if China now relaxes its COVID policy? Not that there's any sign it really wants to do so in any major or significant way, but what would happen?
Well, I think they're concerned that, again, because of this immunity gap with lower vaccination rates, particularly in the elderly population, and the elderly population is more likely to suffer from severe COVID or require hospitalization. So that there's a double whammy right there. And China, compared to other countries in Asia, has less ICU beds available, a weaker healthcare system, fewer healthcare workers. So their major concern is now that overall there's low level of infection present within the community. There's also this vaccine hesitancy issue, particularly in the elderly population. And that has been present in every country in the world, so that's not unique to China. But it's interesting that it's in that demographic. So there is this concern that the people who need the protection the most will end up filling up hospital beds and that they'll run out of room because there just isn't that same level of people who might have milder symptoms now because they've experienced it previously.
It's interesting what you're saying because it speaks directly to what China's ambassador to the UN was saying as well. Is there's going to be there is a trade-off if you open up, if you relax the restrictions on COVID, you're going to have more infections and more deaths. Is that fair?
Well, I think we need to definitely be measured about it because there's lots that you can do that isn't the same thing as a very blunt, severe lockdown. I think most of the lockdowns that have been even experienced in Europe and other countries around the world were not as extreme in its form as in China currently and in the past. So where the restriction of movement is really, you're not able to get outside for exercise or even access basic health care. So again, I think it almost means a different thing when we talk about it to this extreme. You can still have, for instance, one of the great practices of wearing face masks if symptomatic, etc. That helps reduce spread. Having indoor public spaces with air filtration systems, that helps to reduce spread. And we've now had 3 years of COVID. So really, the question remains as to why not a mix of vaccines have been introduced, particularly using the more efficacious ones and leading booster programs to prevent this. Because really, lockdowns are only in place to save time for things like mass vaccination. It's not something that can just be rolled out permanently.
Oksana Pijik, thank you very much for joining us on the show. Really interesting to get your perspective on all of this. Somali security forces have ended a siege by Al-Shabaab fighters at a hotel in the capital that lasted nearly a day. At least 9 people were killed after gunmen stormed the Villa Rose Hotel in Mogadishu. It's close to the presidential palace and is regularly used by government officials. Several people were rescued. Aljazeera Arabic's Omar Mahmoud has more from the Somali capital.
The attack targeted the hotel, which is located in a secure fortified area close to the presidential palace. Security officials, parliamentarians, and other prominent figures from the Somali government were present in this hotel. The attack started with some explosions outside the main gate. Then gunmen affiliated with Al-Shabaab entered